Have you ever wondered what actually happens to your body, specifically down there, when you stop being sexually active? I'm Dr. Grace Holloway, and I've been practicing medicine for over 20 years now. And let me tell you, this is one of those topics that men ask me about behind closed doors all the time, but nobody wants to talk about it out loud. So today, I'm going to break it all down for you. No fluff, no beating around the bush. Just straight talk, real science, and practical advice you can actually use. Because here's the thing. What happens when you stop using your penis isn't just some abstract medical curiosity. It's something that affects millions of men, especially as they get older. And the consequences? They're more serious than most guys realize. So let's get into it. First, I want you to understand something. When I see patients in my clinic, and I'm based out here in the Northeast, been serving the community for 2 decades, the number one thing I notice is that men don't want to bring this stuff up. They'll come in for a blood pressure check, a cholesterol panel, maybe a sore knee, but the real reason they're sitting in my office, they're worried about what's going on below the belt, and they're embarrassed. I get it, I really do. But here's what I always tell my patients. There's absolutely nothing to be ashamed of. This is your health. This is your body, and you deserve to understand what's happening to it. Now, let's talk about why men stop being sexually active in the first place, because it's not always what you think. A lot of people assume it's just about getting older, like it's some inevitable thing. But that's not the whole picture. Not even close. There are real, specific reasons this happens, and once you understand them, you can actually do something about it. That's what separates good medicine from just throwing your hands up and saying, well, I guess that's life. The first major reason, and this is the one I see most often in my practice, is relationship trouble. And I don't mean some big dramatic blow up. I'm talking about the slow, quiet erosion that happens over years. You and your partner stop communicating. Little frustrations pile up. Maybe there was an argument 3 years ago that never really got resolved, and now it sits between you like a wall. You stop reaching for each other at night. The physical distance grows because the emotional distance grew first. I've seen this pattern hundreds of times. A couple that used to be close, used to be passionate, and now they're more like roommates. One partner feels ignored or invisible. The other feels criticized or shut out. And intimacy, it just fades away. Not overnight. It's gradual, like a fire that nobody's adding wood to. It just slowly goes out. Here's what makes this dangerous from a medical standpoint. When you stop being intimate because of relationship issues, your body starts to adjust. And not in a good way, your testosterone levels can dip. Your confidence takes a hit. And the longer you go without sexual activity, the harder it becomes, both physically and psychologically, to get back to it. It becomes a cycle. You pull away, your body adapts to the absence, and then when you want to reconnect, it feels like trying to start a car that's been sitting in the garage all winter. So what do you actually do about this? First, and I know this sounds simple, but it's not easy, you've got to talk to your partner. I mean, really talk. Not about the grocery list or who's picking up the grandkids, about how you feel, about what you need, about what's missing. I've referred couples to therapists who specialize in relationships for older adults, and the results can be remarkable. There are also exercises you can do together, and I'm not talking about anything embarrassing. Simple things like scheduled date nights, holding hands more often, making eye contact during conversations. These small acts of reconnection can reignite intimacy in ways that surprise people. The point is, don't just accept the distance. Fight for your relationship because your sexual health depends on it. The second big reason I see men become sexually inactive is grief. And this one's tough to talk about. When you lose someone you love, whether it's a spouse, a partner, a close family member, the pain can be so overwhelming that it shuts everything else down, including your sex drive. I had a patient a few years back, a retired teacher from upstate New York, 72 years old. His wife passed after a long battle with cancer. He told me, "Doc, it's like somebody turned off a switch inside me. I don't feel anything anymore. Not hunger, not joy, not desire, nothing." And that's a perfectly normal response to profound loss. Your body and mind are in survival mode. They're processing something enormous, and non-essential functions, including sexual desire, get pushed to the back burner. But here's what I need you to hear. Grief doesn't have to be permanent. The loss is permanent, yes. That person isn't coming back. But the shutdown you're experiencing, that can change. Your body can wake back up. The problem is that a lot of men get stuck. They adapt to the numbness. Months turn into years, and before they know it, they haven't been intimate with anyone, or even with themselves, in 5, 6, 7 years. And the body responds to that. Tissue changes, blood flow decreases, muscle tone in the pelvic floor weakens. These are real, measurable physical changes that happen when the penis goes unused for extended periods. What I tell my grieving patients is this: give yourself permission to heal. That doesn't mean forgetting the person you lost. It doesn't mean replacing them. It means acknowledging that you're still alive, that your body still has needs, and that honoring those needs isn't a betrayal. If you're struggling with this, please consider talking to a grief counselor or a therapist. There's no timeline for healing, but there is a difference between grieving and being stuck. And if you've been stuck for a long time, a professional can help you find your way through. The third reason, and this one's purely medical, but it's chronic illness. When you're dealing with something like heart disease, diabetes, prostate cancer, or any condition that requires long-term treatment, your sexual function is almost always affected. And it's not just the disease itself, it's the medications. Beta blockers for blood pressure, they can tank your libido. Antidepressants, same thing. Chemotherapy and radiation, they can cause fatigue so severe that the idea of intimacy feels about as realistic as running a marathon. I've had patients going through chemo who told me they felt like their body wasn't even theirs anymore. Everything hurts, everything's exhausted, and sex is the last thing on their mind. And I totally understand that. When you're fighting for your life, intimacy takes a back seat. That's normal and it's okay. But what I want you to know is that it doesn't have to be the end of the story. Once treatment stabilizes, once you start feeling more like yourself again, there are real steps you can take to rebuild your sexual function. And I'm going to give you those steps right now, because that's what you came here for. Not just the problem, the solution. So let's talk about what actually happens to the penis when it goes unused, and then let's talk about what you can do about it. When you stop having erections regularly, whether from sex or from natural nocturnal erections, the tissue in your penis begins to change. The smooth muscle that allows blood to flow in and create an erection starts to be replaced by collagen and fibrotic tissue. Think of it like this. If you put your arm in a cast for 6 months, when that cast comes off, your arm is thinner, weaker, and stiffer. Something similar happens to penile tissue. Doctors call this disuse, atrophy, and it's a well-documented phenomenon. Studies published in the Journal of Sexual Medicine have shown that men who go long periods without erections experience measurable decreases in penile length and girth, as well as increased difficulty achieving erections when they try again. But, and this is the important part, it's reversible. At least in many cases, especially if you catch it early and take action. Here's what I recommend to my patients. And these are practical, evidence-based strategies that you can start today. Number 1, Kegel exercises. And yes, men can and should do Kegels. These exercises strengthen your pelvic floor muscles, which are directly involved in erections and ejaculation. Here's how you do it. Next time you're urinating, try to stop the flow midstream. The muscles you use to do that, those are your pelvic floor muscles. Now practice squeezing those muscles for 5 seconds, then releasing for 5 seconds. Do that 10 times, 3 times a day. You can do it sitting at your desk. Watching TV, driving your car, nobody will know. Research has shown that men who do Kegels consistently for 3 to 6 months see significant improvements in erectile function. This isn't some gimmick. It's physical therapy for your most important equipment. Number 2, use it or lose it. I tell my patients this all the time. Regular erections, whether from sexual activity with a partner, solo activity, or even just natural morning erections, keep the tissue healthy. They bring fresh, oxygenated blood into the penile tissue, which prevents that fibrotic buildup I mentioned earlier. If you're not currently sexually active with a partner, that's fine. Self-stimulation serves the same physiological purpose. I know some guys from my generation were taught that it's something to be ashamed of, but from a medical standpoint, it's maintenance. Plain and simple. Aim for at least 3 to 4 erections per week to keep the tissue in good shape. Number 3, get your cardiovascular health in order. Your erection is basically a blood flow event. If your arteries are clogged, your blood pressure is out of control, or your heart isn't pumping efficiently, that's going to show up in your sexual function. often before it shows up anywhere else. In fact, erectile dysfunction is sometimes the first warning sign of cardiovascular disease. So take care of your heart, walk 30 minutes a day, cut back on the processed food. If your doctor puts you on a statin or blood pressure medication, take it. And if you smoke, for the love of everything, quit. Smoking is one of the absolute worst things you can do for erectile function because it damages the blood vessels that supply the penis. Number 4, talk to your doctor about your medications. This is huge, and most men don't do it. If you're on a medication that's killing your sex drive or making it hard to get an erection, tell your doctor. There are often alternatives. A different blood pressure medication, a different antidepressant, a dosage adjustment. These small changes can make an enormous difference. Don't just suffer in silence because you're embarrassed to bring it up. Trust me, your doctor has heard it all before. And if they haven't, they should have. This is part of your health, and any good doctor will take it seriously. Number 5, consider talking to a urologist or a sexual health specialist. If you've been inactive for a long time and you're having trouble getting things going again, there are medical interventions that can help. Medications like sildenafil or tadalafil, you probably know them by their brand names, can be very effective. Vacuum erection devices are another option that works well for a lot of men. And for more severe cases, there are even surgical options like penile implants, which have very high satisfaction rates. The point is, there are tools available. You don't have to figure this out alone. Number 6, address your mental health. I can't stress this enough. Depression, anxiety, stress. These aren't just emotional problems. They're physiological ones. They affect your hormone levels, your nervous system, your blood flow. If you're struggling mentally, your sexual function is going to suffer. Period. Consider therapy. Consider meditation or mindfulness practices. Even something as simple as getting outside for a walk in the fresh air can make a difference. Your brain is your biggest sexual organ, and if it's not in good shape, nothing else is going to work right either. And look, I want to be real with you for a second. I know that for a lot of you watching this topic feels heavy. Maybe you're dealing with one of these issues right now. Maybe you've been dealing with it for years and you've just accepted it as your new normal. But I'm telling you, as someone who's spent over 20 years helping men with exactly these problems, it doesn't have to be this way. Your age is not a sentence. Your diagnosis is not the end. And the fact that you're watching this video right now tells me that somewhere inside you, there's still a part of you that wants things to be different. Listen to that part. I've seen men in their 70s and 80s rediscover a sexual vitality they thought was gone forever. I've seen couples who hadn't been intimate in a decade find their way back to each other. It's possible, but it requires action. It requires honesty with yourself, with your partner, and with your doctor. And it requires letting go of the shame and the stigma that so many men carry around this topic. You've spent your whole life being strong for everyone else, taking care of your family, working hard, showing up. Now it's time to take care of yourself. Your body has been there for you every single day. It's carried you through everything life has thrown at you. Don't abandon it now. Give it what it needs: movement, care, attention, and yes, pleasure. You've earned it. If this information was helpful to you, I'd appreciate it if you'd share this video with someone who might need to hear it. And if you've got questions, real questions about your specific situation, drop them in the comments. I read every single one and I'll do my best to address them in future videos. This channel is for you, and I want it to be a place where you can get the straight answers you deserve without the runaround. I'm Dr. Grace Holloway, and I'll see you in the next one. Take care of yourselves, gentlemen.